Have you ever wondered what the future may hold for you? If I asked you where you plan on living in the next few years, I can guarantee you could give me an answer. But if I asked you where you plan on living in the next 40 or 50 years, what would you say? Realistically, this is a difficult question to answer because where and how we live depends on our health. Welcome to Demystifying Medicine, where we will be taking a look into long-term care in Canada. First, we will discuss what long-term care actually is, the types of long-term care, and some challenges residents face. Lastly, we will investigate ways we can support long-term care, so let's get started. According to the National Institute of Aging, long-term care is a service used to help individuals live as independently as possible once they are no longer able to perform their daily activities. Individuals normally are in need of long-term care if they experience a disability or an ongoing health condition. There is no specific criteria that outlines who should be receiving long-term care. Instead, here is a list of factors that may increase the risk. Age. As individuals get older, an illness may develop gradually. Gender. Women pose a greater risk than men in receiving long-term care due to their longer life expectancy. Marital status. Single people are in need of aid more so than those living with a partner. Lifestyle can influence one's diet and exercise habits, and genetic family history can increase one's risk of disease. However, any individual with diminished capabilities can benefit from long-term care, as well as people from varying ages. The long-term care one engages in is dependent on the person's needs. Let's take a look at the types of long-term care. The type of long-term care one engages in is dependent on their needs, which determines if it will be permanent or temporary care. Short-term care is for those recovering from an operation, and long-term care is for those needing ongoing help with a chronic condition. Long-term care is offered in different locations by different healthcare professionals. Number 1. Home-based long-term care. Unpaid family members can provide home-based long-term care services. This involves personal care in an individual's home with bathing and supervision, and is short-term. Paid caregivers, such as nurses and therapists, can also provide home-based long-term care services. Number 2. Home health care. Home health care is when a physician or therapist provides medical services for a condition. The person may be recovering from surgery or illness. Number 3. Assisted living communities. Assisted living communities are fully equipped homes and apartments that allow seniors to maintain their independence. They hold 24-hour supervision and assist with daily living in the areas of eating, bathing, dressing, transportation, and maintaining medication intake. Number 4. Nursing homes. Nursing homes are ideal for those who can no longer live independently and require constant care. The nurses taking care of these individuals offer rehabilitation services and assistance with daily living. Number 5. Alzheimer's care. Alzheimer's care is offered in assisted living communities. It is 24-hour supervision to ensure their safety and quality of life. Additionally, these long-term care facilities offer a range of social activities such as communal dining and group outings. Individual plan of care. Each resident in a long-term care home has an individual plan of care. This is so they may live comfortably and have all their needs met. Their plan of care includes information such as their health conditions and medications they may need, their diet, religious practices, and exercises they must perform that's recommended by a healthcare professional. This individual care plan is updated every 6 months or whenever required. Now we will be shifting our focus to the current challenges in long-term care homes. First, COVID-19. The coronavirus has resulted in an increase in global mortality rates, leaving a devastating mark on the world. When COVID-19 hit, it disproportionately affected long-term care homes. Why is that? The older population is more vulnerable to disease due to their weakened immune system. In the year 2020, long-term care residents had a death rate 13 times higher than adults of 69 years who are not in long-term care facilities. So let's see what a healthcare professional working in a long-term care home has to say about COVID-19.
I am a registered nurse. I'm working in a long-term care since 2019. So actually, this is a loaded question. COVID-19 affected long-term care in a various ways. So one of them, they affected the resident themselves. So many times they had to be in isolation. COVID impacted the loved ones. So the loved ones couldn't sometimes come to visit because we are in isolation, which was really devastating for the resident and for the families. That was so stressful for everyone. As nurses, basically we do physical assessment, we do assessment for them, we give them medication, we help feeding the resident. As with COVID, we still do the same things, but we have a little bit more responsibility now. We need to monitor more for the COVID-19 signs and symptoms. Prior to COVID-19, we didn't have to wear masks. Masks is a very, very big change in the long-term care, and this is something affected the communication between us and the residents. So the challenges that we're still having from COVID. One of the challenges is we need to do rapid tests every day. As employee, every day we come, regardless wherever you work, you have to come to the front desk and you have to do screening. If we are on outbreak, we are not allowing general visitors to come. We cannot, according to our home policy. So because of that, some of the residents, they feel so frustrated because they cannot have anyone to come and see them.
To protect this vulnerable population, there has been and continues to be a focus on disease control, not only for COVID-19, but for other infectious diseases. Now, there are still strict regulations put in place to protect residents, such as screening and rules to wear mandatory masks. There are barriers to achieving the safe environment. For instance, compliance of all visitors and access to sufficient personal protective equipment are challenges that still need to be addressed. Ageism. The World Health Organization defines ageism as how we think, feel, and act towards others based on age. Ageism is one of the least challenged discriminations in healthcare and can manifest in small ways within the healthcare system. Easily seen in birthday cards or social media, it is the most socially accepted form of discrimination. How does ageism manifest itself in long-term care homes and the treatments residents receive? In residential settings, ageism is related to social attitudes and stigma about disease, such as COVID-19 or dementia. This affects the quality of care and respect they receive. This is why it is crucial to have mandatory discussions among staff in residential settings. Let's see what a healthcare professional working in a long-term care home has to say about ageism.
So all human beings, regardless of their age, their color, their occupation, they need to be treated with respect and in a humane way. Getting older, it doesn't mean that you're losing your self-respect. This specific age group, it's a little bit different than dealing with regular or younger adult, because they perceive anything in a different way. They don't sometimes you need to give them more time. You need to give them to be more patient with them. You need to listen to what they're saying. You need to repeat yourself. Their vision is, they may have tunnel vision. They cannot see what you see. They cannot feel what you feel. We have education, which is a course that we need to do. It's called GPA, Gentle Persuasive Approach. It's just teaching you how to deal with this age group. In this way, you are de-escalating, you're putting them in the right environment without having any casualties, emotional or physical. So this is a very nice and good course, and we're making sure that all of our staff are having GPA. After a few months spending some time with these people or this age group, I felt what they feel. This is their home.
How can you support long-term care homes? For COVID-19, follow the protocols set in place. These are to protect all residents and to allow visitors to continue visiting as safely as possible. Ageism. You can encourage discussions about ageism amongst friends and talk about micro examples of how it is seen in society. The reason ageism is swept under the rug is because there isn't much awareness about its effects in long-term care homes. Today, we covered what long-term care actually is, types of long-term care, some challenges individual residents face, and different ways we can support them. So next time you are asked about the future 40 or 50 years from now, you'll know what to say. Thank you.